Hello and welcome to At the Heart of Health with Dr. James Marcum. In today's well-marketed world, it's hard to know who or even what to believe when it comes to health care. In each program, Dr. Marcum, a board-certified behavioral cardiologist, takes a balanced approach using common sense modern medicine and the ultimate source of truth, the Bible, recognizing that at the heart of health is love.
Today we have Dr. Ken Scott joining us. He is a new breed of doctor called a hospitalist. We didn't have that about 20 years ago. Hospitalists are doctors that work in the hospital. They do all sorts of different activities. We're glad that Ken's joined us today. Dr. Scott's going to tell us a lot about what a hospitalist does, how we can use them more effectively, and answer some common questions he gets on a daily basis. Ken, I'm so glad you joined us on At the Heart of Health. And tell me, what got you interested in medicine as a career?
Well, thanks for having me, Jim.
You're welcome.
I think I always was interested in being a doctor. I think that was the career I wanted from the very beginning. When I was a little kid, I wanted to be a doctor for some reason. I'm not really sure what got me that interested in it, but as I progressed with my education, I thought, what a great thing to be able to help my community out and help my family out, and I thought it would be a rewarding thing to do.
Good. Now, you're married, have kids?
I do. I'm married and I have 3 kids.
How old are they?
My oldest is 21
Wow.
and is in college, and then I have a 17-year-old and a 15-year-old.
You look very well preserved, or you started very young, one of the two. Well, we're glad you're here. Listen, tell me, what is a hospitalist? You know, it used to be, that's a sort of a new word for a lot of people. Just tell us what is a hospitalist is and what are their responsibilities.
Well, a hospitalist is, as you said, a doctor that practices mainly in the hospital. It's really like specializing in the hospital care of a patient.
So you specialize on acute problems?
Yes.
Okay.
Most hospitalists, about 70% of hospitalists, are board-certified internal medicine doctors. The other 30% are pediatricians, family practice docs. There actually are some general surgeons and some OB/GYN hospitalists. And in each case, their job is really involved with just taking care of the patients in the hospital rather than having office responsibilities or going outside of the hospital to deliver care.
So a hospitalist actually stays in the hospital?
Yes.
Now, how long are you in the hospital for?
Well, there are different models as to how they run. Our program, we are in the hospital for 12-hour shifts. So we have, in our program, we have 4 doctors that are there all day long for 12 hours, 8 a.m. to 8 p.m. And then at night, we have a hospitalist that is there all night to take care of problems during the night that come up.
Well, that's really good, because so if you had a patient that had a problem, you know, if you were in your office, you couldn't help that, but as a hospitalist, you can go there right away and help out, right?
Exactly, and that's part of the benefit of having the program.
Now, that seems like an awful lot of intense work, working 12. Do they give you time off?
Well, yes, and again, that varies from program to program. The way ours is set up is we do 7 days on, 7 days off. So our hospitalists will be there for a 12-hour shift every day for 7 days, and then they're off the next week.
Now, how many years have you been doing this type of internal medicine?
Well, actually, I graduated out of my internal medicine program and within 6 months was involved as a hospitalist. And as far as I know, it was the first program in the state of Tennessee.
So you've seen this evolve.
I have from the very beginning. And what we've become now is a lot different than what we started out to be. So it is an evolving process over about 17 years for me.
Well, I think as the economy changes and as there's reforms in healthcare, I think we're going to see more and more of this hospitalist model care almost everywhere.
Absolutely.
Because it just ends up being more efficient, especially if you have good information systems.
Correct.
Now, if a doctor, let's say, if a doctor has one of his patients that come in, do the hospitals see them as an outpatient, or do they go back to their regular doctor? How do you all work that out?
They go back to their regular doctor after their hospitalization is done. And again, there are different ways of doing this. What we do in our hospital is any patient that does not have a regular doctor that comes to the hospital for care and ends up needing to be admitted, we admit that patient and take care of them while they're in the hospital. On top of that, most of the physicians, primary care docs in the community actually work with us and ask us to admit their patients. So we do both of those things, patients that don't have a regular doctor and primary care doctors in the community that want us to take care of their patients when they're in the hospital.
So hospitals don't really have an office per se, though, except the hospital.
That's correct.
Okay, well, that's sort of a new concept, you know, sort of doctor without walls.
Yes.
What we've done, Dr. Scott, is we have got questions that come into HeartWise Ministries from all over the world having to do with specifics of internal medicine, and we're going to try to answer some of those. Hopefully we'll have the answers. And if you're out there and you have a question that you want to get to us, just go on the website, heartwiseministries.org, and we'd be happy to answer your health question. We also give second opinions. So the first one, I think we've already covered this. And this was a person that's writing from Nebraska. She's 72. She says, recently I was in the hospital and I was seen by a hospitalist. However, I do not have a primary care doctor. What would be my next step?
Well,
you know, so she's already been seen, all the acute stuff's taken care of. She just needs some follow-up, it sounds like.
What should happen in that situation, and what we do in our hospital, is that we have doctors that are assigned to take these patients so that we have somebody to send them to. It's important to have follow-up. Just because you're discharged from the hospital doesn't mean you are actually ready to fly on your own and don't need any further care. And so what we try to do is actually assign the patient to a doctor that will be responsible for seeing them, at least for a visit or two after the hospitalization, and make sure that everything is going well, they understand their medications, they're getting better and flourishing after the hospitalization.
Right. So if she might have miscommunicated, but if she doesn't have someone, she should either call the hospital or just go in the phone book, or?
I would call the hospital back because
they might have assigned her and she might have missed out on it.
Exactly. And also there are usually case managers in the hospital that work with the Hospitalist program, and usually they can figure out who it is that she was supposed to see and get her pointed in the right direction.
Right. Okay. Our second one comes from California, actually, and this is an 82-year-old, and she writes that all of my friends have been receiving lots of different vaccinations. Some gets the flu vax, some gets the vaccine for shingles, and some gets the pneumococcal vaccine. She says, I'm very nervous about vaccines. I'm actually worried about catching the disease. What would be some of your recommendations, as she asked? So she's 82, and let's say she's 82 and healthy first, and then we'll say 82 with lots of other medical problems second.
Right. Well, it's kind of a tough question to answer for several reasons. One is, as you know, there's been a lot of controversy in the news lately about whether vaccines are safe. Are you going to get something bad by getting the vaccine? And for the most part, vaccines are safe, but there are adverse reactions that can occur from vaccines. Anywhere from simple things like getting pain at the injection site, maybe having a little bit of, you get the flu shot and you get a little bit of flu, achy symptoms afterwards for a day or two, to actually having an allergic reaction, a full-blown allergic reaction because of something in the vaccine that you're allergic to, such as eggs or something that it is made in. So in all those instances, what you need to do is talk to your doctor personally to find out what your risks are for getting that vaccine. If you're talking generally about what the CDC, the Centers for Disease Control, recommends, when you're talking about elderly people, and for the most part that starts at the age of 50 to 60.
50? Wow.
Yeah, I'm getting elderly. Basically, they're recommending that most of these vaccines be given depending on what it is. Influenza, they're saying every healthy adult even should have it by the age of 50. It's a yearly vaccine. The pneumococcal vaccine for pneumonia age 65 is what they recommend. The shingles virus, that vaccine, they're saying the age of 60, you should have your vaccine for that.
Now, in the shingles virus, can you still get the shingles vaccination if you've already had the shingles?
Yes.
Is it still beneficial?
Yes, it is beneficial. And the thing to remember about all these viruses, these vaccinations, is that what most people think is, well, I got vaccinated, now there's no way I'm going to get this.
Right.
And that is not really true. It reduces your risk, and even more so, it helps prevent having a really serious illness. You can actually have a lighter illness because you were vaccinated. For instance, in the...
so milder.
Milder, right. For instance, in the shingles vaccine, it probably reduces, in patients over the age of 60, it probably cuts their chance of getting shingles by about 50%.
Wow.
So, you know, I mean, there's still a chance you're going to get it, 50-50 chance, but that is a lot lower than if you never got the vaccine. And even more important is some of the side effects, the painful side effects that you can get that are greatly reduced by getting the vaccination.
You know, in heart disease, we say the patients that are the weakest, you know, the worst hearts, the most delicate situations, they benefit from even taking that risk. They benefit so much because if they had either pneumonia or they had the shingles, it could really upset the balance of the heart, put too much stress on the system, and they can actually succumb from these illnesses when their heart's not strong enough to keep them
Exactly.
well. We're going to come back in a few short moments. We've been talking to Dr. Ken Scott, a hospitalist who specializes in acute care medicine. If you have a question, we'd like to invite you to log into our website, heartwiseministries.org, where we'd be happy to answer your question either online or on a program like this. Join us in a few seconds. We will be right back.